I want to talk a little bit about what's likely to happen. When you go through a campaign and you hear the issues that the candidates raise and have a chance to hear how the philosophical differences between the candidates affect issues of concern, as in this case in terms of health care, you understand the kind of directional guidance that presidents are able to provide, how much regulation and who does the regulation, how much reliance on incentives and who receives those incentives, how much a plan might cost. But it's important to remember that in our system, the president proposes and the Congress disposes. Each of these proposals, the Obama proposal and the McCain proposal, are going to face serious challenges as I see them when it comes to working with the Congress. For Obama, where does the money come from? I know that David has said he's going to let the Bush tax cuts expire. Fine, that's nice. That pays for a portion, in my view, of the cost of the plan. But there have been many other proposals that have been raised as well. David mentioned the $2,500 of savings that each family will be able to achieve. Now, I certainly think that there are many ways we can find to spend smarter in this country, changing the reimbursement and the incentives that occur as a result, having more and better information, comparative clinical effectiveness, and other ways. But the likelihood that we will be able to achieve significant savings within a first presidential term, to me, just belies credibility. Now, again, as I've said, it doesn't really matter what I believe. It will matter what the Congressional Budget Office believes, because when it scores the proposal, that's what it is. Anyone who was part of the Clinton administration knows as well that was, if not the seal of doom to the Health Security Act, it was a major nail in the coffin. For Senator McCain, the real challenge is going to be how to get what is assuredly going to be a Democratic Congress to seriously consider the tax code changes that he is proposing. I'm assuming that there is not going to be 60 sure votes in the Senate going in one direction. And the point of saying that is it means that if we are going to have any health care reform in this next session of Congress, it's going to require crafting a bill that can have a bipartisan majority support working with the administration. I think we could have had significant health care reform in 1993 and 1994, and we let that opportunity slip through our fingers because there wasn't a willingness to have all of that happen. I hope that we will not do that again and want to indicate the importance of, as we go into this next period, of understanding that when we end this campaign, that is what it will take to have health care reform. And of course, I won't resist saying, one of Senator McCain's great strengths has been his ability to reach out, to find people on the other side of the aisle and the other party that he can forge alliances with, occasionally to the consternation of his own party, in order to take positions that resolves issues that he thinks needs to be resolved. It will be a critical element in whether we get health care reform in 2009 or 2010. Thank you.